Yes.
That moment, I think every single pet owner knows it. You look over at your dog or your cat and you just realize something has shifted.
Hmm.
Maybe your cat, who's usually all over you, is suddenly hiding. Or your dog, your super energetic dog, gets all stiff and defensive when you just, reach for their collar.
Right.
They're acting, for lack of a better word, just weird.
And it's that moment of deep uncertainty, isn't it? Because they
Yeah.
can't tell us what's wrong. They can't point and say, hey, my back hurts, or I have a headache.
Exactly. So how do we decode that? Is it just a funny quirk? Are they bored? Or, and this is the big question, are we missing a sign of a real health crisis?
Yeah.
That's the whole mission of this deep dive.
Yeah.
We're unpacking a ton of clinical and behavioral sources to build a kind of a triage roadmap for you. We want to give you a clear framework to spot the subtle stuff, to understand what a symptom might mean, and to know exactly when you need to call in specialized help.
And that framework is so urgent. In veterinary medicine, behavior is a fundamental clinical indicator. We treat it like a vital sign.
A vital sign. I like that.
It is. And it leads to the core principle that every owner really needs to internalize. Any sudden or sustained change in your pet's personality or routine has to be considered medical until proven otherwise.
So think doctor first, behavior second.
Always. If a pet is acting strange, it's a communication of distress or discomfort or, disease.
And getting on top of it quickly, it's not just about their quality of life, right? It's really preventative care for the whole family.
Absolutely. Our sources all underline that behavioral issues, aggression, severe anxiety, house soiling, these are clinical conditions of distress.
Yeah.
And they are, tragically, a leading cause of pets being relinquished to shelters.
Wow.
So early detection it's everything. It's a difference maker.
Okay, let's unpack that core principle then. If we're starting that triage process, what are the most common medical issues that fool us, that look like just plain misbehavior?
Pain.
Pain.
Hands down. It's the absolute king of the masqueraders. Pain is the single most frequent and yet the most often missed underlying cause for these anomalies.
So why do we miss it so often?
Because chronic discomfort, it creates this continuous physical stress, and that stress just erodes their emotional resilience. A pet that's normally super tolerant suddenly has zero fuse because their body is fighting this constant, invisible battle.
Oh, okay, but if my dog is limping, I know they're in pain. What are the signs we're missing? The non-obvious stuff.
We're looking for shifts in habit.
Mm-hmm.
Things like difficulty rising, it might just be a little stiffness in the morning, or are they panting a lot even when it's cool? That can signal pain.
And posture, too.
Yes, watch their posture. An arched back, a stiff way of walking, or always carrying their head a little lower than usual. That's them trying to compensate for joint or spinal pain.
And cats.
Yeah.
Cats are a whole other level of hiding it.
Oh, they're magnificent concealers. With cats, the signs are usually subtle withdrawals. A cat who used to greet you at the door but now just hides. Or one who stops jumping onto the kitchen counter where they used to love to sit. That's a huge red flag for pain. Also, watch for excessive grooming of just one spot, or suddenly avoiding being touched. They just get irritable because moving hurts.
Let's talk about the connection between pain and, well, aggression. That's the vicious cycle that can put people, and especially kids, at risk.
It's a critical link.
Yeah.
If a pet is in discomfort, their only goal is to create distance from anything that might make it worse.
Right.
So if you reach for a sore spot and the dog growls or snaps, and you immediately back away, which is a totally normal reaction, the dog just learned something.
That the aggression worked.
Exactly. The aggression is negatively reinforced. They learn acting this way equals safety. And that learned survival tool can stick around even after the pain is gone.
So the pet isn't being mean, they're just defending themselves. Okay, beyond physical pain, what about other systemic issues, things that might look like a mood swing?
You have to consider everything happening inside. For instance, sensory decline.
So going deaf or blind.
Right, especially in older pets. It can cause profound anxiety. If they can't properly identify what startled them, their baseline fear level just skyrockets. We also see huge personality shifts with endocrine imbalances.
Give us an example of that.
Sure, thyroid conditions or kidney disease. These things can flood the system with toxins or just throw the whole internal chemistry out of whack. And that shows up as agitation, restlessness, or just a lower stress tolerance.
So that cranky old cat yowling all night.
Might not just be confused. They could be hyperthyroid or have high blood pressure. Both are very treatable. And even simple things like a UTI in a cat can cause them to soil outside the box because they start to associate the box with pain.
Always rule out the simple medical fix first.
Always.
Okay, so if we suspect a medical issue, and especially if the change is really sudden, really dramatic, our sources say to look straight at the brain.
Yes, these are conditions that need immediate specialist attention, and they often present with really similar overlapping symptoms, which makes diagnosis tricky without the right tools.
Let's run through the 4 big neurological disorders in dogs where behavior change is a huge sign. First up, inflammation.
Right, so we're talking about things like meningitis or encephalitis. It's often autoimmune. And the inflammation of the brain causes confusion, personality changes.
What else would you see?
You might see seizures, stumbling, a real lack of coordination, sometimes even compulsive things like walking in circles or sudden blindness.
Okay, and then there's the really acute event, a stroke.
A stroke is.
Yeah.
The key word is sudden, a blood flow blockage to the brain. One moment they're fine. The next, they have terrible balance, they're walking like they're drunk, or have weakness just on one side.
And seizures again?
Seizures are common there too, yeah, due to the sudden lack of oxygen.
Then we have brain tumors, which are sadly more common in older pets.
Right, and these cause pressure, leading to symptoms that get progressively worse over time. Again, you'll see compulsive circling, wobbliness, balance issues.
And finally, a genetic one that sounds awful, Chiari-like malformation.
It's a complex condition where the skull is literally too small for the brain.
Wow.
Yeah. And the unique behavioral signs there are sensitivity or pain around the neck and shoulders, and something owners call phantom scratching.
What's that?
The dog scratches uncontrollably at the air near their shoulder, but without ever actually making contact.
Since all of these seizures, circling, balance, loss overlap so much, how do you get a definitive diagnosis?
You really can't, just from observation. Definitive diagnosis requires advanced imaging. A high-field MRI is the gold standard. It's the safest, most accurate way to see the brain and rule things in or out.
And while we're on the brain, let's talk about aging pets. You mentioned chronic pain can speed things up, and that leads right to cognitive dysfunction syndrome, or CDS, pet senility.
Yes, this is so critical for anyone with a senior pet. CDS leads to confusion, anxiety, forgetfulness. For cats, we actually use an acronym to help owners remember the signs. VISGAL.
VISDA, okay, break that down for us, because these are things people just dismiss as old age.
Right, stands for vocalization, so excessive meowing, interactions changing, sleep-wake cycles being off.
Pacing at night.
Exactly. House soiling, disorientation like getting stuck in corners, changes in activity, anxiety, and deficits in learning.
So what's the most common one people report?
The nighttime vocalization. That relentless yowling cat. If you see 2 or more of those signs consistently, it's absolutely time to talk to your vet about CDS.
It's a relief to remember, though, that not every weird behavior is a crisis. Let's shift gears and talk about the fun, normal quirks. We have to start with the best one, the zoomies.
Ah, the zoomies. Or FRAPs, frenetic random activity periods.
FRAPs.
It's a totally natural, healthy way for pets to just release pent-up energy in these short, crazy bursts.
It's like a pressure valve.
It is, and it's essential. If you try to suppress the zoomies, that energy just turns into frustration, which can lead to destructive behaviors later. We should celebrate the zoomies.
Okay, what about the cat butt wiggle before they pounce?
That's pure instinct. It's a muscular warm-up, letting them gauge their balance and trajectory right before they leap.
And dogs tilting their heads. We all think it's so cute.
It is cute, but they're probably doing it to better locate sounds. And some research suggests they do it to get a better view of our facial expressions around their own muzzle.
And the really gross one, rolling in disgusting smells.
Pure, unadulterated instinct. It comes from wild ancestors who use strong scents as camouflage to hide from prey. We find it repulsive, they find it strategic.
So these are all good signs, but when does something like chewing or digging stop being a quirk and start signaling a real problem?
Destructive behaviors.
Yeah.
Once you've ruled out medical issues, they're almost always a symptom of chronic understimulation or boredom. If a dog's left alone all day in a boring house, they will make their own entertainment.
And that usually involves the couch.
Usually the couch, yes.
Okay.
They're trying to alleviate a deep-seated frustration.
So there's a direct line from boredom to anxiety.
It's the boredom-frustration axis. And if it continues, it can progress. That frustration leads to what we call displacement activities, like excessive paw licking or tail chasing.
A coping mechanism.
Exactly. But if the environment doesn't get better, those coping activities can become neurologically hardwired as compulsive behaviors, and those are much, much harder to treat.
Which means we need to understand their language before it gets to that point. Let's talk about the canine ladder of communication, the signals they give before a bite.
Yes. The first stage is what we call the whispers. Appeasement behaviors. We miss these all the time.
Like what?
Yawning when they're not tired, lip licking when there's no food, rapid blinking, turning their head away, or showing whale eye, where you can see the whites of their eyes.
They're basically saying, I'm uncomfortable, please stop.
Precisely. And if we ignore those whispers, they escalate. They'll stiffen up, stand crouched with their tail tucked, or give a hard, fixed stare. That's the final warning.
And that leads to the most critical takeaway for every dog owner.
The growl. The growl is not bad behavior. It is an invaluable warning signal. It means, I am stressed, and you missed all my earlier, quieter signals.
So what's the danger in punishing it?
The danger is, if you shout at a dog for growling, you are teaching them to suppress that warning.
You're taking away their ability to give you a fair warning.
Exactly. You are conditioning them to go straight from feeling uncomfortable to biting without a sound. The right response is always to back away, remove the stressor, and figure out how to prevent it next time.
Okay, let's switch to cats, who are so much more subtle.
Completely different. And we often misinterpret them by applying dog rules. A perfect example is the tail.
Right, a wagging tail on a dog is good. On a cat.
A twitching, thrashing tail on a cat means agitation, irritation, maybe aggression. Right. Only that upright, confident tail is a friendly signal.
And when distress turns into house soiling, that's probably the most frustrating issue for cat owners.
It is, and you have to differentiate. Urine spraying on a vertical surface. That's territorial as anxiety. But toileting outside the box, on the floor, that's often a direct response to a physical problem, like a UTI, or an aversion to the box itself. Maybe it's not clean, or they don't like the location.
And what about when they choose to go on the bed, or on a pile of laundry?
That signals intense, debilitating anxiety. The cat is trying to eliminate in a place that smells most like their source of security, which is you.
They're mixing their scent with yours to feel safe.
Exactly. It's a cry for help, a sign of high emotional need.
So let's say we've ruled out medical issues. The behavior is clearly environmental. What are the key things we can do at home?
Structure. Structure is paramount, especially for dogs. Predictability is calming.
So same feeding times, same walk times.
Yes. Consistent routines reduce that restless, destructive behavior that comes from instability.
And giving them a way to escape when they need to.
A designated safe zone, absolutely essential. A crate, a specific bed, a corner that is always interruption-free. It teaches them to self-soothe.
And this applies to cats too, right?
For cats, it's even more important. They need vertical spaces and hiding spots to feel secure.
And what about mental stimulation? It's not just about tiring them out on a walk.
No, mental enrichment is just as important. Use puzzle feeders, chew toys that make them think, and go on sniff walks, where you let the dog lead with their nose. That mental work tires them out way more than just physical exercise.
And for separation anxiety, it sounds like managing our behavior is half the battle.
Crucially, keep your arrivals and departures low-key. No big dramatic goodbyes.
Right, because that just ramps up their anxiety.
It does. Use short, gradual absences and always provide a high-value food puzzle when you leave. Teach them that being alone is safe and even rewarding.
And underlying all of this is positive reinforcement.
It is non-negotiable in modern behavioral science. You use rewards, treats, praise to encourage good behavior. And you must avoid punishment. No shouting, no force, no restrictive collars. It just makes fear and aggression worse.
Okay, so when the home solutions aren't enough or the problem is just too big, we need to know who to call. Let's break down the team. Who handles what?
Okay, so if the issue is just basic manners, leash walking, obedience, you start with a certified trainer.
And the next step up, if there are some mild fears involved.
A behavior consultant. They can help modify mild fear, low-level destruction. They design modification plans.
But for the complex stuff, severe aggression, intense anxiety, anything that might be neurological, that's when you need the specialist.
Correct. The veterinary behaviorist, a DACVB, this is the highest qualification. They are licensed veterinarians who've done a multi-year residency just in animal behavior.
And why is that veterinarian background so critical?
Because they can diagnose and treat the entire system, the physical and the emotional, at the same time. They're the only ones who can prescribe medications like SSRIs, which are often vital for lowering a pet's stress enough so that the training can actually work.
So they can treat the underlying thyroid issue and manage the anxiety that came from it.
That integrated approach is essential for complex cases. There are also certified applied animal behaviorists, or VCAMEs, who have PhDs in animal behavior. They're brilliant with modification plans, but they have to work with a vet for any medical needs.
The message here is really about empowerment, isn't it?
It is. It's about empowerment through understanding. You now know that any sudden change needs medical triage first. You know behavior is a vital sign, that subtle things like a lip lick matter, and that positive reinforcement is the only way forward.
That proactive approach is so valuable, and it's a good reminder that routine vet exams are key for catching those hidden things, dental pain, arthritis, before they become a full-blown crisis.
Establishing that healthy baseline is everything.
Absolutely. So we want you to take everything we've talked about today, the subtle signs, the red flags, the importance of enrichment, and apply it in your own home. The way your pet communicates, whether it's through a growl or just pacing at night, it's often a reflection of a core need that isn't being met. So, considering everything we've discussed, what's one specific behavior you've seen recently that you now see in a completely new light? We invite you to explore that connection between your pet's physical comfort and their emotional stability and just see what you discover next.